Hey guys, welcome. All right, Cozy Talks Live. We are back. For those of you who are watching the replay, welcome. I love to hear from the guys watching the replay. Ooh, I should probably connect my microphone so you guys can hear me and I don't have to shout. That usually helps. Good heavens, where is it? All right, Cozy, get your act together. All right, so if you're watching the replay, go ahead and comment replay and list any questions that you want for me to answer. I do like to go back after the show is done to go pick up any of those questions. And then we got a lot of people on board tonight. Can't wait to see everybody. For those of you watching the show for the first time, welcome. My name is Cozy Belloso. I'm a physical therapist here in hot, still sticky, still humid Tampa, Florida, and we're right in the thick of hurricane season. So buckle up, kids. We're going to be in for a ride this season. Hopefully, not as wild as it was last year. I've been a physical therapist now for 23 years, and my passion is working with the amputee and limb loss community. We have some really great thought-provoking questions on for tonight. But first, I want to say hello to everybody who is here. All right, we got G.I. Jane on board. We got Mark. I didn't realize you were from Colorado Springs. I love me some Colorado Springs. I was there for the past 2 summers. Love it up there. Love it up there. We've got Scott coming in from West Virginia with cold water in his cup. Boring, I know. Cheers to you, my friend. I am plugging the water tonight in my frou-frou Stanley flowered mug right now. That's all right. We'll give you guys a pass on the water tonight because that's what I got in my cup. We got Christy Dayton coming in from Auburn, Nebraska. Benny from Texas. There's my Texan Marine guy right there. Hoo-yah. We got Cindy from Eastern North Carolina, a Tar Heel drinking her Starry Zero. Marianne Thompson with her ice water for her. We got Floyd saying, is there any possible fix for the shocker type pain where piriformis is involved? Floyd, that is an excellent question, and it's actually going to piggyback off the marquee question for tonight. So stay tuned for a few more minutes. We got Bill on board coming to us from North Arizona with a Cold Coors Banquet. Nice. Susan and Marshall are tuning in to their favorite show. Which show is that? No, I'm kidding. Always loving having you here. Marsha coming in. Oh, Marsha, I am so glad to see you from Hudson, Florida, my fellow Floridian. And thank you for writing me back and keeping me posted on your progress. Okay, who's got the handle ham sandwich? Because that's just hilarious. Somebody named Ham Sandwich is listening in from Fort Wayne, Indiana. Phantom pain sensation discussion tonight. Sign you up. Yes. Let's just say we can always talk about phantom pain because I could do a whole talk show just on that, like a whole Cozy Talks just on phantom pain and phantom sensation. So yeah, buckle up, Ham Sandwich. Guys, as a reminder, I am broadcasting to Facebook, to Instagram, to YouTube, and now to Rumble. So you can join in on any one of the fruit flavors of where I am broadcasting, even though right now it looks like Instagram is not behaving itself, and I'm not sure why. Anywho, we got John on board. We got Marty listening in from Texas. I got another Texan there tonight with his Blackberry sparkling water. Jim from Ohio. Ham Sandwich says, I haven't had phantom pain for weeks, then got it Saturday morning at 2:30 a.m. That kept me awake when I was set to be racing out of town an hour and a half away all day. Dang, that stinks. I think of all the phantom pain episodes I hear about from patients and viewers, it's the middle of the night ones. I would say like that's the one that I just see people break down in those middle of the night, 2 o'clock, 3 o'clock, 4 in the morning episodes. And it stinks. We've got Victor coming in from Tennessee with his Sprite Zero. Bronze Eagle. Man, we got a lot of really cool handles coming in from YouTube today. Can you guys like tell me your names? Actually, I don't know. I think the Ham Sandwich and the Bronze Eagle are really cool. Bronze Eagle saying he or she's got phantom pain 24/7. Tom coming in from Maryland. Glad, yes, I am feeling much better today. I am not coughing up my lungs anymore, so I'll actually be able to finish a statement today without making y'all listen to me cough like that. That was insane. It's got Michael. Okay. I love the ham sandwich. Don't get me wrong. I love the ham sandwich handle. I think it's hilarious. We got JT coming in from Louisiana. JT, I got your question right here. Howdy. We got Texas. Texas is invading the Cozy Talk show tonight. Do not mess with Texas tonight, man. Do not mess with Texas. We got Harsh coming on board. Was it COVID? No, it wasn't COVID. It was just a run-of-the-mill cold. I don't get them very often. I don't get sick very often, but when I do, it takes me out. It takes me out, but I'm good to go right now. All right, guys, let's start off with the marquee question. So Mark and I have been having a really lovely dialogue over email about phantom pain and phantom sensation. And last week, we talked about the differences, right? And I'm going to go through it again because I see there's a couple of new people on board. Que pasa, Eric from Fort Lauderdale? Welcome aboard, man. Okay, so I'm going to explain the differences between, and then why is it that I make a distinction, okay? So when I'm talking about phantom limb pain, I'm referring to phantom limb pain, phantom limb sensation, and residual limb pain, and understanding the differences between the three, okay? So phantom sensation, okay, that is, hey, compadre, that is when you can feel your foot that is no longer there, okay? So you're looking down, there's not a foot there, but you can feel the foot. You can feel the toes. You can feel the toes wiggling. You can feel pressure on those toes, but there's no pain associated with it, okay? It's just that. It's just the sensation, the feeling. You might feel some pressure. You might feel even a tickling sensation every once in a while, but nothing that you would call discomfort, right? It's just, it's there, right? That's it, okay? Then there's phantom limb pain. That is phantom sensations, evil, wicked stepsister that someone dropped a house on her head, okay? So phantom pain is phantom sensation with a whole lot of pain, okay? And I don't have to describe it to you guys, but the descriptions I've heard from patients and viewers over the past 2 decades that I've been in practice is crushing, burning, tearing, electrical, stabbing, poking, nauseating, okay? And how it presents can be in so many different ways. For me, phantom pain is as unique as a set of fingerprints. I've never met an amputee who has the exact same presentation of phantom pain as another amputee. There's always nuances involved. There's always differences in when it comes on, how long it lasts, how often it happens, what triggers it, what relieves it, okay? There's a whole slew of things right there. And I think that's honestly what makes it some of the most challenging thing to treat in amputee care. Okay. Let's see. Pedro says, thank goodness I've only ever had phantom feeling. Okay. Then there's something called residual limb pain. Okay. Residual limb pain is pain that is originating in the limb that is still there, not the part that was amputated. Okay. And it can be due to several reasons. Okay. Usually it means that there's either a neuroma, there can be scar tissue, there can be a bone spur, osteophyte. Okay. It's something within the limb that hurts. And the tricky part is the residual limb pain can trigger phantom limb pain. Okay. So that's where it kind of gets a little dicey, right? Christy says phantoms happen when you argue. Yeah. Yeah. And we're going to get into that in just a minute. We're going to do a lot of COSI polls tonight because I know phantom limb pain is like it's like the holy grail of amputee care. You know, the person who discovers the cure for phantom pain, it'll be the holy grail, right? And I do want to hear a lot from you guys tonight because I think a lot of people who are watching tonight, first of all, I think I have a lot of new folks from what it looks like watching tonight, and a lot of folks that probably don't know that they're not the only ones going through this, and hearing how everybody else is going through it helps people kind of deal with it, right? Susan says, you know how crazy my journey's been. The one thing I've been lucky with, knock on wood, is I've never had phantom anything, but I've had a boatload of limb pain, but no phantom. Girlfriend, you get a pass because Susan, you've got a story and a half. And if anybody gets a pass on phantom pain, it should be you, Susan. So I am glad to hear that you don't suffer from phantom pain. Okay, so let's talk about why does this happen? Why does this happen? Okay. And I've said this for years and I'll keep saying it. If you line up 10 different clinicians, we're all going to give you our reasoning as to why this happens. Okay. And there's not been one solid consensus. Okay. The best guess that I have been able to piece together over the years through literature, through talking to surgeons, through talking to amputees, is it revolves around neuroplasticity. Okay. Neuroplasticity. So what does neuroplasticity mean? It means the brain's ability to adapt. That's basically what it means. Like plastic, like plasticine, like Play-Doh, it can be adapted. Okay. Where do we see this? All the time. All the time. Whenever you're learning a new skill, okay, whether it's a fine motor skill, gross motor skill, your brain is developing new neural pathways. It's adjusting, it's adapting. Okay. In more extreme cases, we will see it when people have a traumatic brain injury, right? They have this horrific accident. I remember working in the traumatic brain injury units and seeing these people who had these horrific accidents and they looked like vegetables. And you're sitting there going, how in this world is this? Number one, how is this person still alive? And number two, what's going to happen to them? And I would see so many cases of people who were in these vegetative comas, for lack of a better word, right? To use the more common term. And months later, they're walking, right? And you marvel at the brain's ability to heal, to adapt, okay, and to move on. Does it always happen? No, but it is possible, okay? So in terms of, we're going to get to that in just a minute more. Mark is asking, should it ever be treated? And we're going to get to that because there's a reason why I tend to take a long way to get to my answers, but there's a reason why I make a distinction between phantom pain, phantom sensation, and residual limb pain. Okay. So when it comes to neuroplasticity, there's good adaptation and then there's bad adaptations. Right? The good adaptation is things like the traumatic brain injury, where the brain figures out how to move again. It learns the new movement patterns along with intensive therapy and specialized physical therapy and occupational therapy that help the brain relearn these skills. Okay. I use these strategies when I'm teaching my amputees how to walk again. I'm tapping in to the brain's neuroplasticity ability. Right? The proprioception exercises that I use, weight bearing exercises that I use, movement strategies that I teach my patients, all of this is to feed the brain and give it a good adaptive experience. Okay. So part of that adaptive experience is when the brain is trying to figure out, okay, what just happened here? The part of the brain that normally senses your foot, it's sitting there going, hello, hello, anybody home? And it's getting crickets. Why? Because there's no longer a foot there. The foot is not there anymore. Sorry, I'm having trouble speaking today. The foot's not there anymore, but the nerves are still sending signals and everything is just getting jumbled up. Okay. So what happens? Well, the brain decides, well, we're going to try to adapt this way. And this way can sometimes be pain. Okay. Pain. Now, there is so much involved in this. And so much of this, guys, I'll be the first one to say it's over my head. And it's over the head of some of the most brilliant surgeons I've spoken to, over psychiatrists. Okay. There gets a point in time where we simply don't understand the full picture of phantom limb pain. Okay. Is there a psychological component to it? Yes. Yes. Am I a psychiatrist or psychologist? No. Okay, but I've spoken to many of them, and it's really, you don't have to be one to see that there is a psychological component to phantom limb pain. Why? Because a lot of people in the phantom pain that they experience the pain that was occurring at the moment they lost their limb. Okay, so one of my examples that I use is one of my runners, a young woman who lost her leg in a motorcycle accident. And when she feels her phantom pain, she feels her foot basically hanging off the way it felt when she was being taken to the emergency room from the scene of the accident. Okay. There's people that when they think back to the trauma of losing their leg, that triggers their phantom pain. So do I believe there's a psychological component? Yes, I do. Yes, I do. And I do believe that that is also a part of how we can treat it. Okay. So we've talked about what we think causes it. Now the question is, how do we treat it? Okay, how do we treat it and why do we treat it? All right, let's take a quick break here. Let me catch my breath. Let's see. Okay, Bill says, does ill-fitting prosthetics increase phantom limb or residual limb pain? Absolutely. Okay. And this is where it's important to distinguish. Okay. So usually when my patient comes in saying, I have phantom pain or I have pain, usually they very rarely do my newer patients tell me it's phantom pain, because some of them may have not even heard of phantom pain. Some of them think they're going crazy, right? I've had many patients come to me and they're like, this is going to sound nuts. I feel my foot, and I just kind of internally chuckle and I say, yes, it's okay. You're not going crazy. Okay. You are feeling your foot, even though it's no longer there. And I explain to them everything I just explained to you guys, right? Okay. But usually my patients will just say, I have pain, and they have a hard time describing it. So the first thing I try to do as a clinician is figure out what kind of pain are they having? Okay. Is it phantom sensation, phantom limb pain, or residual limb pain? Usually I try to go to the residual limb pain first. That's usually one of the first things I try to rule out. Why? Because if there's something going on in the residual limb that is causing that phantom pain, then I've got a much more clear cut path for treatment. Okay. So, again, going back to what are some of the causes of residual limb pain? Neuromas. Okay. Bone spurs, scar tissue. There's a myriad of things that could be going on. If you have a bursitis going on, especially in my below the knee patients, right? If you've got a bursitis going on, okay. And then if we move up the chain, if you've got back pain, if there's something in your back that is triggering, then it can present as pain in your residual limb. Okay. So again, this is where your neighborhood friendly physical therapist can be kind of instrumental in trying to help you figure this out. Okay. If you're not a physical therapist, if you're not a clinician, then the differential diagnosis and prosthetists are not trained in that area. They're not going to be trained in differential diagnosis the way a physical therapist will be. Okay. And let's face it, when it comes to physical therapy, pain is kind of a big thing we deal with. That's kind of our bread and butter, whether you're an amputee specialist, whether you're an orthopedic, sports physical therapist, you name it. Pain is kind of what brings people to come see us. Okay. So distinguishing and differentiating between it, kind of in our wheelhouse right there. Okay. So that's my other little PSA announcement for go see your neighborhood friendly physical therapist. Okay. Back to the main topic. When it comes to distinguishing within residual limb pain, if I can pinpoint something in the residual limb, then chances are I can treat it, or I can find someone who knows how to treat it. Okay. So the more common ones, okay, neuromas. We've talked a lot about neuromas on the show. It's that scar tissue that forms around the end of a nerve that's been cut during amputation. And boy, do those zingers hurt. Okay. If the neuroma is what is triggering your phantom limb pain, that can be treated, and it can be treated a couple of different ways. There are injections that can be done. There are procedures, the surgery targeted muscle reinnervation, or another procedure very similar to it called RPNI. Okay, where the surgeon goes in, they take out the neuroma, they plug it back into a muscle, and the nerve is happy and doing what it's supposed to be doing. Okay, so I guess my point is it's treatable. Okay. And sometimes people don't even have to have surgery. Sometimes with the clever prosthetist doing their clever things with that socket, they can alleviate the pressure that is zinging on that neuroma. Bill, you brought up an excellent point. Do ill-fitting prosthetics trigger or increase phantom limb pain and residual limb pain? Yes. Yes. And that's usually the biggest cause right there. Okay. In the quest for the best fitting socket, okay, people will sometimes get a little bit too happy with making that socket snug. Sometimes it's the prosthetist, sometimes it's the patient putting on too many socks, and that poor little old residual limb is getting strangled in that socket. Okay. And it's because the person, they want to make sure that that socket is suspended on that limb. Okay. But the side effect is boom, phantom limb pain. And it can present one of two ways. Some people will tell me, gosh, I put my socket on, I'm walking on it, and my phantom limb pain just goes nuts. So one of the things I check for is the socket too tight? Ironically enough, I have heard of some people that they say the minute they take their socket off, that's when the phantom pain zings, and it's because their socket's too tight. Don't ask me why. Sometimes the compression, and then they have that rebound effect because the socket is too tight. All right, guys, there's a million different rabbit holes that you can go down in terms of trying to figure out what is causing that phantom pain with issues with the socket. But again, that's where working with your physical therapist, working with your prosthetist, okay, to suss these things out. All right. Now, if I cannot see anything coming from the residual limb, okay, and there are cases where that happens, where I will, and sometimes, guys, it takes me as a clinician, and I tell younger clinicians this as well, it takes time to get to know your patient. Okay. It takes me time to fully understand how my patient's body works and how my patient works. Okay. That's not just in the first initial evaluation. I am constantly evaluating my patients as I continue to see them and I get to know them. I get to know how their body works, how their body moves, and especially in cases with pain. Okay. So there are some times where I'm just sitting there and I'm going, okay, I'm not finding a cause here. I go, well, we're going to try to, try it from a different approach. Another approach is figuring out what triggers the pain. Okay. So let's just back it up and review things. First, understanding whether you have residual limb pain, phantom limb pain, or phantom limb sensation. Okay. Trying to pinpoint where it is coming from. If it's coming from the residual limb, how can you hunt down the cause, the reason for it? Okay. And figuring out what triggers it. Okay. Now, those of you who are my veteran amputees, you can probably tell me with your eyes closed, you're like, Kosi, it happens when the barometric pressure is like this on a day that ends in Y, and I'm wearing red shorts, and you guys have it down to a science. Okay. But my newer amputees, they may not necessarily know what causes or what triggers their phantom pain. And I'll have them start to pay more attention and start to keep a log. Okay. When do you have your phantom limb pain? What time of day did it happen? What were you doing? Did you eat something weird? Were you outside sweating a lot? Here in Florida with all the heat and humidity, it is so easy to get dehydrated. You really have to make an effort to stay hydrated, more so than even Arizona or some of these other hot, dry states. Okay. What were you doing? What was going on in your life? What was going on in your life? What were you doing at that moment? So there was someone back here. Okay. Let's see. Hang on. Boom. So Ham Sandwich Michael there was saying he hasn't had phantom pain for weeks, and then he got it Saturday morning at 2:30 a.m., kept him awake when I was set to be racing out of town for an hour and a half away all day. Stress. Now, the studies in the literature are showing, we're seeing how the impact of stress can trigger phantom limb pain. Okay. So again, Michael, I'm playing Monday morning quarterback here, but I know that when I have to get up at 4 or 5 a.m. for my flights, and I always have the early flights, I don't sleep. I'm up at 2 a.m., 3 a.m. thinking I'm going to miss my alarm. And guys, I've taken hundreds of flights, but it's just that stress. Okay. So figuring out what is the trigger and acknowledging that stress can come in many different flavors and colors, right? It can be emotional stress. It can be physical stress. Okay. It can be hidden stress. Okay. And I'm laughing because as a mom of 4, I have a lot of hidden stress, and I'm used to living with a very, very high level of stress that I've adapted to, right? But the older I get, the more my body tells me, hey, Kosi, that adapted high level of stress that you think you're managing, you're not. And in some folks I know, their stress releases through phantom limb pain, and they themselves might not be aware of it until they get that phantom pain episode. Okay. Hey there, Earl from California. We've got Pam coming in from upstate New York. Chuck in Wyoming made it. Thank you for coming. Michael says, good question, Bill. I feel like I get phantom pain on the foot on days at work. Prosthetic doesn't fit well. Also, sudden weather shifts, temperature drops, or rain days cause phantom pain for others. Yes. And again, I live in Florida. I was joking about how it's hurricane season in Florida. When we have a hurricane coming, if y'all have ever been through a hurricane, right, it's very quiet. When you know a hurricane is getting ready to hit you, everything gets very eerily quiet. And it's like out of a movie, right? Birds stop chirping in the trees. You don't see squirrels anywhere, right? And you just kind of walk outside and it's very calm, okay? And you can feel something changing in the pressure in the air. And I know that for many of my amputees that live in Florida, this will set off their phantom pain. Okay. Let's see. Earl says, after my recent car accident, I was bottoming out and causing pre-amputation knee pain that came back. Yeah. Okay. So again, like going back to Earl, because he said he had an accident where he smacked the end of his stump in that accident, and it was triggering a lot of phantom pain. So again, it's residual limb pain that is triggering phantom limb pain. Okay, so finding a cause. So now let's get back to Mark. I'm finally getting to your side of the question. You're asking, well, isn't it all the same? Phantom pain, phantom sensation? Yes, in the sense that your brain is trying to figure things out, right? That neuroplasticity that I talked about, your brain is trying to figure that out. So, yeah, phantom limb pain and phantom limb sensation, it's like I said, phantom limb pain is phantom sensation's ugly, wicked stepsister, right? But it's important to distinguish because with phantom sensation, I'm not necessarily wanting to treat it. And I know that sounds absolutely bonkers. Okay. But what I've seen over the years is that folks who have phantom sensation that is not causing them discomfort, that's not progressing into a phantom pain, which usually I don't think I've ever really seen that. Usually, what I've seen is people have phantom sensation and it stays as a sensation. People who have phantom pain, it's pain. And guys, by the way, if you have had one of those cases, I'd love to hear from you. Okay. So, people who have phantom sensation, we can sometimes use that to their advantage. Okay. Because of the fact that they feel their phantom foot, when it comes time to use a prosthesis, they have a better sense of proprioception. They really do. And they also tend to feel the socket fit better, right? So if the socket's fitting too tight, I've had one person tell me, I feel like my phantom foot is being squeezed, like it's in a tight shoe. And sure enough, we'll check the socket fit and the socket is too tight. So you can actually use phantom sensation to your advantage in many, many cases. Not everybody. And there's some people that they're just like, yeah, the phantom sensation kind of wigs me out. I don't like it. And we can use some of the treatment strategies for phantom pain on phantom sensation and try to see if we can alleviate that sensation. Okay. But Mark, that's why I really like hammer in distinguishing between the three. Okay. And then depending on what you have will determine if you have treatment and what kind of treatment you can receive from it. Capiche? Makes sense? All right. I want to hear from you guys. First of all, I want to hear, now that I've explained phantom limb pain, phantom limb sensation, and residual limb pain, if you experience any of those three, I want you to put it in the comment section. Like, I want to know what it is that you feel or what it is that you think you feel. Okay. Patrick asks, he's my fellow physical therapist up in New York. Do you do sensory integration as part of your rehab strategies? Yes, absolutely. Absolutely. Once upon a time, actually, I started off when I was a licensed, brand new, shiny licensed physical therapist. I worked as a pediatric therapist for the first year to year and a half. I did pediatrics and OBGYN care. And with pediatrics, we do a lot of sensory integration, right? A lot of kids who have developmental issues stemming from syndromes, long hospital stays. So I worked in the pediatric ICUs, the pediatric transplant, infectious disease, so HIV/AIDS kids. I worked with a lot of these kids that they weren't necessarily born with the syndrome, but because of the fact that they had been hospitalized, their development was very delayed. And a lot of them had sensory integration issues. So as a pediatric therapist, that's something that I worked with a lot. And I took a lot of those strategies and implement them also in my amputee care. Okay. So if I see someone who has a lot of initial sensitivity, so somebody that, when they're fresh out of their amputation, they come in to see me, I rest my hand on their residual limb and they're climbing the walls. Okay. I will do sensory integration techniques to try to desensitize their limb. Okay. And then once we get them into the socket and comfortable in a socket, I'm really hammering in proprioceptive exercises. Okay. And guys, I have no fancy research. I have no fancy literature. This is just me practicing for 23 years. I have noticed that with my patients, when I'm hammering that proprioception from day one, my patients, if they experience phantom limb pain, it's not as severe, or they have very few crisis episodes. Okay. And that's just me. I don't have any literature on that one, guys. That's just me with my own personal experience. Guys, can you? Can you guys still hear me? Can you guys give me? Can you guys still hear me? My was telling me I lost my connection. I hope I didn't lose you guys. Can you guys give me a thumbs up? Oh, nuts. Choppy. I'm breaking in and out. So good to know that I paid extra for like internet connection. All right, guys, give me 1 second. Let me go turn something off and see. Hey, honey, I'm losing connection. Can you just do a quick router check and get people off devices for a minute? Thank you. Okay, guys. Ham Sandwich is saying Kosi's internet's having some phantom pain tonight. I got some phantoms in there. Oh, nuts. Okay, well, I have my dear sweet husband checking in on stuff, and I'm having him wave his magic wand to see if he can fix it, because y'all know I am not tech savvy, so I'm not going to be able to fix it. Let me just kind of start reading back through here some of these questions. We got a lot of comments. I hit a good one here tonight with this topic right here. We've got a lot of great ones here. Steve Plitt says, it feels like I'm wearing a flip-flop that is in between the wrong toes on a foot that I don't have anymore. That can be uncomfortable. Earl says, the impact to the end of my stump woke up the nerves and then going socket bottoming out, right? So there's socket-related issues there. Bronze Eagle says, my back has been kind of numb since amputation, and it feels like the first couple of layers of skin has no feeling. So it's difficult to pinpoint why or when it comes. And again, guys, this is where this is so not an exact science when it comes to treating phantom pain. I've been doing it for 23 years, and I still have cases where I'm like, I don't know what's going on. I don't know what's going on. Have your algorithm on how you approach the case, and you do everything you can. And then honestly, a lot of times I'll rely on the patient saying, okay, what have you already tried? In terms of conservative techniques. Let's see. Mark says, residual limb pain is of course real and it should certainly be treated, but I have been fortunate not to have any of that. Yes. And then Mark, going back to it, phantom limb pain, it's a very real thing. Okay. It's something that can be tracked to the brain. It is a very, very real thing. I don't know if you guys have ever seen those documentaries. I used to watch them as a kid when neurosurgery, brain surgery was becoming, we were having all these advances. And if you guys have ever seen someone who's having brain surgery, and there's documentaries out there, because I remember watching them as a kid and being fascinated by them, where they would remove the skull cap, right? So the brain is exposed, and then they wake the patient up. Obviously, the patient's not feeling any pain, but the patient is awake. And then you see the surgeon touching different parts of the brain, and the patient is moving. They're not wanting to move, but the brain is being stimulated in ways. Okay. And in other cases, there was one video where it was a professional guitarist, and they started playing the guitar in the OR, and electrodes in the brain just started going off. I mean, it was just incredibly fascinating. So, the person and their conscious level sometimes will be controlled by the brain on a subconscious level. So the fact that the phantom limb pain is tied to the brain, we know that for a fact. We know that phantom limb pain is real. Okay. We know that phantom limb sensation is real. Okay. It's how do we approach it? Okay. And again, going back to, does it need to be treated if it's phantom sensation? Okay. Okay. I guess somebody here is taking gabapentin. Yeah. I mean, gabapentin, it is a strong, strong drug. Okay. And guys, I've done shows in the past where I talk about conservative management of phantom limb pain and phantom pain using pharmacology. And I say it all the time. I am not against pharmacology. I'm not, because I've seen some people who have such debilitating phantom pain that they simply cannot function in their lives. They've tried all the conservative techniques that helps them function in their life. Okay. At the end of the day, they're the ones that have to get through their life and their day, not me. However, that being said, when it comes to using pharmaceuticals and some of these heavier medications, keeping in mind these are heavy medications. Gabapentin will knock an elephant out. Okay. So obviously, it goes without saying, it needs to be under the careful supervision of a pain management doctor. Okay. A pain management doctor who is constantly assessing you to see how you're doing and keeping you on the smallest dose needed to allow you to function in your day. Okay. And guys, this is my approach to pain, whether someone has phantom limb pain or whether I'm working with someone who's fresh out of a major surgery. Okay. And I worked several years in post-op units with all sorts of different surgical patients. And my approach with my patients was educating them on the nature of pain as to why they were experiencing their pain so that they would take some of the fear out of it. And then also educating them on the proper use of pain medication and explaining that the purpose of the pain medication is not to completely take their pain away, right? If we were to take all the pain away, they would pretty much be in a coma. It is to bring the pain level down so that they can be functional in their life. Whether it's coming out of surgery or whether it's dealing, must be done with the help of your doctor and your team. And I've seen some very successful cases, guys, where a person was on a very high level of gabapentin. They wanted to slowly wean themselves off, and working with the doctor and then using other conservative techniques, they weren't able to get off the gabapentin completely, but they were able to significantly lower the amount that they had to take and also decrease the side effects associated with it. Okay, that's a whole nother show, guys. That's a whole nother show. All right. Mark, where you been, man? It's been a while. Let's see. Jeff says, what I found that helped the most with neuroplasticity, I say my prayers each night, get in bed and count my blessings. Then I turn meditation music and go to sleep, and it takes time, but it gets better. Yeah. Okay. Now, again, some people will say, well, the psychology, that's all woo-woo stuff. It's not. It's not. Psychology is a very real thing, and how it's tied into who we are as human beings. Again, science cannot explain it 100%. Okay. Also think about stress. Okay. Remember what I said. The number one cause of phantom limb pain that is not attributed to a neuroma or a bone spur, stress. And we all know that stress will present itself in many different ways. In some people, it increases their blood pressure. In other people, it messes with their thyroid. It'll mess with their glucose, right? We all know now that stress can be a killer. Okay. So it makes sense that in an amputee, stress can set off phantom limb pain. And techniques such as prayer, such as meditation, such as music, anything that calms the nervous system down. Okay. Yeah. Chrissy says gabapentin helps me sleep. Yeah. Ronnie says a great fitting socket will promote a healthy environment for your limb. A healthy limb is a happy limb. Yeah. And it goes back to, Ronnie, for me, it again, going back to my own personal experiences and working in this field is, the earlier my patient can get into a socket, that's another big thing right there. And the sooner that we can start hammering in those proprioception exercises with a well-fitting socket, right? And it all goes back to, if that socket isn't fitting right, we can't get anywhere with it. Yeah? We're tying in a lot of things here. Well-fitting sockets, team approach, right? Because in order for your socket to be fitting beautifully, your prosthetist has to be on his or her game. Your physical therapist has to be on his or her game, and they need to be communicating with each other. Yeah. Horror movies. I'll tell you what, if there's one thing that will set off my stress, it's watching a horror movie. You're looking at the biggest chicken on the planet for horror movies. And I married someone who loves watching horror movies. Right? In this world, there are two types of people who love horror movies and people who hate horror movies, and then they marry each other. Okay. So yes, horror movies will set me off. So if I were an amputee, I'm pretty sure that would set off my phantom limb pain. It's stress. It's stress at the end of the day. Ham Sandwich, I'm just going to keep calling you Ham Sandwich because I just love that handle. He says it's been dry and hot for a few weeks, but then a storm front came through Saturday. So on top of the stress and excitement of racing that weekend, the weather shift coming on probably caused it at 2:30 a.m. Yeah. So as weird as this sounds, though, you know what your trigger was. you know what your trigger was. Okay. So, like He-Man would say, knowing is half the battle. Revealed my age on that one. It'd be interesting to see on your next race day, which again, I've done several races as well. And that's another one for me. The night before a race, I'm jittery. And it's like, I'm not a professional athlete. It's not like how I do in the race is going to impact my life in any significant way, right? But just good stress from knowing that I've trained for a race, knowing that I have to be up early and I have to be on time at that start line or I will not get in the race, all that kind of stuff. Am I going to eat the right thing? Everything that goes into a race, it's a stressful environment, right? So it would be interesting to see, okay, do you have any relaxation strategies that you use, right? The night before a race. Okay. And here's another interesting thing. And this is because I'm a runner nerd. I love running. I love running races. And one of the things that I've read from a lot of running experts, especially if you're getting ready to do a long distance, like a 15K or a marathon, half marathon or a full marathon, people stress out so much about getting rest. Oh my gosh, it's the night before the big race. I have to sleep. And what they've shown is if leading up to your race, you've been eating well, you've been drinking well, you've been training well, and you've been sleeping well, okay, if you don't have the most best night of sleep before the night of your race, you still can perform very well. And honestly, just even knowing that has taken the stress off of me on some of my races, knowing, okay, if I didn't get the best night of sleep, I've slept well all the rest of the week prior, I'm going to be fine at the race. So again, I'd be curious to see Ham Sandwich and Michael, next time you have a race, how can you implement some more of these relaxation strategies? Hey there, Steve. Good to see you, man. Let's see. Bill says maybe creating a journal would helpful and zero in on commonalities. And yeah, and I have my patients do that, Bill. Some of my patients, like I said, they know exactly their phantom pain. They've got that phantom pain social security number, birth date, FBI profile. They know that phantom pain, what causes it and what relieves it and what aggravates it. Some people, they're lost and they just don't have a pattern. So I have them start writing down everything. Whenever they have an episode, write down whatever it is that they're experiencing. And hopefully we start to see a pattern somewhere, or just even writing it down and gets you right there. Yeah. XIX Pop. I am getting some really cool YouTube handles. I love it right now. So Earl says, feeling my foot does help with walking, right? So those of you who have phantom sensation. So Bill says, I feel pain in my residuals and it's excruciating pain. And again, Bill, it would be, I'm sure you've had that evaluated on several occasions. Excuse me. Ham Sandwich says, I now have phantom sensations in my knee and shin vibrating, just laying here listening to the stream. Oh my gosh. And guys, this always happens and I always feel so bad. There's inevitably some of you that just talking about phantom pain starts to make the pins and needles start in your limbs. And that makes me feel so bad sometimes. Because I'm here yammering away about phantom limb pain. And then somebody starts to say, Cozy, I got to duck out because it's starting to happen. So my friend Robin, it happens to her. Greg, and here's the irony, guys. Greg Menino, I got to call him up, man. I haven't talked to Greg in a couple of years. I need to get back in touch with him. Phenomenal human being. He's a 22-time Olympian and Paralympian, and he's a prosthetist, and he's an above-the-knee amputee. He and I used to do a ton of shows back in the day on skin management, and we did a huge show. For me, it's still my favorite show that I did on phantom limb pain. And he's hosting the show with me, and he's halfway through the show, he's like, Cozy, it's starting. Like I'm feeling the pins and needles in my limb just because we're talking about this. Let's see. Marty says phantom limb pain, PLP. Likening to wearing shoe 4 sizes too small and phantom limb sensation. Yeah. And that can be incredibly uncomfortable. So it'd be interesting to see, Marty. And again, I'm just throwing out stuff. Sometimes the people who feel like that sensation of the phantom pain, that they're wearing a shoe that's way too small for them, I sometimes wonder if it correlates to how their socket is feeling. It's easy to check out, right? Check out to see the fit of your socket. Let's see. Mark S says that his residual pain feels like an electric shock. So again, is it residual limb pain or is it the phantom limb pain that feels like an electric shock? If it is the residual limb, then How can we chase down the cause? Scott says, I can still feel mine. I'm wiggling my toes, but not painful at all. I get phantom pain as well, and always at night. Much better now than a couple of years ago, thankfully. And again, here's what's interesting, especially those of you who consistently feel your phantom pain at night, along with, okay, looking for sources of stress, things that happen to you during the day that could be manifesting themselves at night in terms of stress, in terms of phantom limb pain. Other people get nightmares, right? Or bad dreams. Glucose. And this is something that I'm kind of learning more about as I explore more about nutrition and functional nutrition. But understanding that, especially if you eat later at night, how that spikes your glucose, even if you're not necessarily diabetic, and how that can interfere with your sleep patterns. So wouldn't that be a cool study to do that, to see folks who are experiencing phantom limb pain at the 2, 3, 4 a.m. And it's not something obvious like ham sandwiches race the next day, right? That they just experience this. It'd be interesting to track their glucose levels and see if there's any kind of a correlation there, and their eating habits. Are you like me, where at 10 or 11 p.m. I get the munchies and I have to keep myself from raiding the pantry, right? Or do you stop eating at 5 p.m., which is kind of the recommended? I know it sounds kind of early, but it's kind of the recommended time for people to stop eating, 5, 6 p.m., right? When the sun goes down. Interesting things to talk about. If anybody wants to fund that study, give me a call. Let's see. Patricia Higgins says, I get phantom pain. My amputation is due to a blood clot after surgery. And for 2 days before the amputation, I had pins and needles in my leg. Now my phantom pain comes as pins and needles in my leg and foot. And again, it's that, for me, that is just like, okay, it's the brain remembering, trying to figure things out. Okay. And again, can we give the brain, in essence, something else to think about? Right? Can we give the brain something else to think about? Tom says, osseointegration above elbow patient. I have a myoelectric arm with a band cuff. When I wear it, it comes down. It calms my phantom sensation down, and it makes me think that my arm has grown back to its original length. Your brain is a very powerful tool, and it's hard to trick, but after time, it does get better. Isn't that incredible? And when we think about, targeted muscle reinnervation, and guys, I'm crossing my fingers. I'm going to put it out there. I really hope that TMR Nerve can become a sponsor next year. I really enjoyed working with them a couple of years back because it really tied in everything, all of this beautifully, right? And how TMR originally was meant to help rewire the nerves of under the arm to allow someone like Tom to use a myoelectric hand, a mind-controlled hand, right? And as a result, they found that this procedure also helps with phantom limb pain. It's kind of cool. Christy says, test socket 3 months and then feel like I have foot heel it hurts to stand on. Okay, so Christy, if there's any pain going on with that socket, darling, you have got to get yourself back to that prosthetist and keep working it out right there. Okay, because there should be no pain. And I've got at least one prosthetist here on board, and I know he'll back me up on this one. There should be no pain with wearing a socket. No. Bill says it starts out as a light pain and then increases to the moon. Okay, and again, if you haven't already tried it, Bill, keeping a journal and just seeing if you can find some kind of a pattern. I'm behind on these comments, but I'm going to catch up, guys. Marsha says, I always feel my foot, but sometimes it feels like my shoe is way too tight and it throbs. Yeah. It's back, but then okay, this is me. Hopefully by now my reception has been a lot smoother. Mark says, I would say that I have sensation always, but pain only sometimes, but simply ignore anything that would present as pain because I know there's no foot there, and that is just my experience though. And guys, some people that can happen. Okay, with some people it really is, again, there's so many different ways of managing phantom pain and phantom sensation. Some people tell me that just from putting their hands on their residual limb, looking at their residual limb, and I tell people to do this, by the way. This is one of the treatment strategies I tell people to do is take your hands, put them on your residual limb, do gentle massages, do some gentle tapping on the residual limb, but looking at it so that your eyes are sending that information to your brain that there is nothing there anymore, and that you're processing all that feeling and it's going to your brain. Okay. Let's see. XIXP Pop says, I have phantom limb pain and phantom limb sensation. Lousy proprioception to date. 1.5 years as a BK. Pop, Long Island, New York. Okay. And guys, let me tell you something. When it comes to proprioception and teaching the brain proprioception, it's never too late. You can teach an old dog new tricks, right? I've had people come in months. I've had people come in years after their amputation. I had one lady, she came to see me 6 years, 7 years after her amputation, below the knee. She was probably about 74 when she came to see me. And she had done pretty well. I mean, she was able to get around with a cane, but she had always been very active prior to her amputation. Nobody had ever recommended that she go to physical therapy. And I don't even know how she found out about me or how she heard about me, because she didn't know about the show. So I don't know how she came across my name, but she came to see me and we were able to successfully get her walking without a cane. And it started with teaching her proprioception again. So it's a skill that can be relearned. It requires strategic exercises, right? It's a very specific set of strategies and techniques, and it requires consistency. That's probably the biggest takeaway right there, is consistency, so that your brain has time to relearn, to get that good adaptation in. Yeah. Let's see, ham sandwiches. I take 900 milligrams of gabapentin in the morning and 900 again before bed, sometimes 1200 in the morning if I know it's a high activity day. More likely to prevent it. Hate taking meds, but it does help me. Okay. And, yeah, that's a pretty high dosage. And again, I don't know much about the details of your case. So, you need to function in your day. You need to function in your day. And then knowing that if you should ever decide you want to try to come down, or if you've already tried it, maybe you've already tried and it wasn't successful. Okay. Greg Ross says, sensation increases about half hour before the bolt of lightning that strikes my foot. So you can feel it coming on, almost like an aura that people feel before they have a seizure. So yeah, that, and again, it's going back to, if you're getting that sensation, is it possible to head it off at the pass and do certain strategies to try to see if you can prevent it from becoming a full-blown pain, or no? And again, trying to see, like, what is it that brings that on? And that's usually the rabbit that I try to chase, is what is it that's triggering it? And so we got a few more folks here on gabapentin. Bronze Eagle says, I quit pain meds when nothing worked and went from 3 times my gabapentin to got put on Suboxone and now have 3 different kinds and nothing works. So why use it, was my thought. Okay. Well, again, Bill saying, I've been on gabapentin for years. I've always been told it's phantom limb pain. And now I'm thinking it's residual limb pain. And again, I'm not saying this to throw anybody under the bus. My own cousin, who's basically my brother, another brother to me, he's a pain management doctor here in town, and he and I always, when we have family, we always have good conversations about this. It's finding a pain management doctor, and usually I think physical medicine and rehabilitation doctors, PM&R doctors, are the best ones that an amputee can have. If you can find yourself a PM&R doctor to manage your care as your primary doctor, I think they're the best, because they deal with amputees. They have more experience. And I like to think of them in many ways as the rehab. I mean, they are the rehab doctor. They're the rehab doctor. So how they approach patient care, it's different in many ways than how a family practice or internal medicine doctor will approach patient care, right? They do look at the rehab side of things. They do look at the functional mobility of the individual more so. Why? Because, that's their job, right? So when it comes to, a patient showing up at their doctor's office saying, doc, I've got pain, a doctor is going to think phantom limb pain a lot of times, and especially if they don't necessarily have extensive experience working with amputees, enough experience to understand that there's a lot of issues that can be happening, triggering this kind of a pain, right? And especially if it's a doctor who's not necessarily an orthopedic doctor, right? Orthopedic doctors, they're going to try to look for an orthopedic cause, right? They might be looking for a bone spur. They're going to be looking for, general practitioners, not necessarily. Not necessarily, unless they have that specific experience and training with amputee care. And I've seen it happen. And it's not because they're not good doctors. It's just simply they don't have the experience specific to that. Okay. Let's see. Oh, guys, I hope my reception's gotten a little better. Ask the question, does CBD have it, but also be able to function for work and active life? And that is something that I have been saying for a while now that I need to start reading up on. And I truly do. I truly do. Anecdotally, I've heard of several people who say that CBD topically applied has helped with their phantom limb pain. The responsible thing for me to say as a clinician is if you're going to take any of these kind of pharmaceuticals, you need to be checking with your doctor to make sure it's not interacting with any of the medications you're taking, even if it's topical, because topical gets absorbed into the bloodstream. Okay. So just because it's available over the counter, okay, doesn't mean that it's just, open season, right? You need to be responsible if you're going to be taking any of these items. And then again, it also goes back to finding a trigger, finding the root cause, so to speak. Okay. So whatever treatment it is you decide to go through, is it appropriate to the cause of your phantom pain? Okay. If you have something like a neuroma, if you have something like a bone spur sitting in your limb, okay, I don't care how much CBD you slather on or how many gummies you eat, it's not going to solve the root cause of that problem. Capiche? Okay. Yeah, and Bill says it seems as though doctors are just diagnosing as PLP, phantom limb pain. Yeah, and a lot of times it'll happen because it's kind of like the common thing that, doctors know amputees, phantom limb pain. Okay, let's treat it. And it's like, well, it's a lot more nuanced than that, folks. And again, another big thing, like I said, way in the beginning of tonight's show, I said that a lot of times phantom limb pain is being triggering by an ill-fitting socket. Not a whole lot of doctors out there that know about socket fit. Okay. PM&R doctors, a lot of them do. And I'm thinking right now, one of my favorite PM&R doctors, Dr. Howie Weiss over at Brooks Rehab over in Jacksonville, he's going to know about socket fit, right? He's going to know to check out his amputee patients for that. Okay. So again, guys, team approach, your physical therapist, your prosthetist, and your doctor. Okay, so that if your doctor is not as experienced in working with amputee care, then the physical therapist and prosthetist can help guide things there. Okay. All right, let's see what else. Diaphragmatic breathing reduces anxiety. Yes. Yes, breathing strategies, right? And I know there's always a couple of people in the audience going, oh, that's woo-woo stuff. No, it's not. It's not. You can put you don't even have to have fancy research equipment. You just get an O2 sat monitor that has a heart rate. Start practicing your breathing exercises and see how that affects your heart rate. Okay. See how it affects the heart rate. All right. Let's see. Oh, car racing, not running racing. I race car and autocross. Well, that's kind of cool. All right. Well, we can still apply the running race analogies there. We can still play. I'm sure you've got to go through all your pre-race things and you've got your pre-race rituals that you go through. Well, that's cool. I've always wanted to do that. Always wanted to do that. So quick story. When I graduated PT school, I had been driving my grandfather's old clunker. It was an 88 Ford Escort, guys, 88 Ford Escort. And by the time I was driving it, it was over 20 years old. Okay. It was an old car, not 20 years old. It was 15 years old. Sorry, my math was off. It was about 15 years old. So it was a little old Ford Escort, my little clunker mobile, right? So I graduated PT school. Thankfully, I didn't have any debt. And the first thing I did is I saved up money to buy myself a cute little Miata, cute little used Miata. And I've always wanted to take a Miata out on the racetrack and just ring it out. Okay. Total random there. All right. Van Gregory says, I hardly ever sleep well the night before a race and still perform well. Van Gregory, you're just a beast. That's why, because you're just a beast and you're amazing. But yeah, it happens all the time. And I've seen, I think, Hal Higdon, he's considered to be like the father of marathon training, right? He's written books. He's been around for decades. Right. And he was the one who said, guys, if all your training leading up to the race is good, then you'll perform well on race day. Okay. Bronze Eagle says, I've only found one thing that helped, but I'm not allowed to have it because it's bad. Let's leave it there. Johnny V. Holy smokes, there you are. Johnny V. advertising for us the Amputee Coalition's 40th anniversary conference in January 2026 in Las Vegas, in Sin City. All right. Oh, yeah. We'll see. That's gonna be a fun conference right there. So Bronze Eagle says that they had compartment syndrome. Oof, and that is exquisitely painful. That is exquisitely painful to have. And now always has a sense of being crushed. Yeah. Robert, what's going on, Rob? Oh my gosh, I saw your last post on your last adventures. I don't know what far-flung part of the world you were at, but it looked like you guys were having fun with a fashion show there, and I love it. By the way, one of these days, Rob, I want to go host your fashion show. I'm just putting it out there. Just putting it out there. Let's see. XIX Pop says, I get the 2, 3, 4 a.m. phantom limb pain enough to wake me up, and I find that moving my residual foot across the carpet to alleviate it. Right. Also to alleviate it. And again, so along with finding what is the trigger, finding what alleviates it. I've heard some seriously wackadoo things that alleviate phantom limb pain. But honestly, when someone tells me one of those wackadoo things, I'm like, well, if it's not illegal and it's not harming you, then go for it. Okay. We'll leave it at that. I've had some people tell me some really wackadoo things. But one of the more interesting wackadoo things was Reggie, my buddy Reggie. He's a bilateral blood linear amputee. He's been on the show several times. And he's been an amputee for, I think, over 40 years now. And he had heard about turmeric, the spice, the Indian spice turmeric, as being a potential for treating phantom limb pain. So he tells me he's on a road trip one day and his phantom pain starts zinging in, and he's, alone driving out in the middle of nowhere, and he has mustard packets in his car, and he just slurps in the mustard, and he said it helped because mustard contains, a lot of turmeric. So whether or not, he said, I don't know if that was a placebo or if it was actually the turmeric that took effect. He goes, I just took it. And I'm like, you know what? It's not illegal and it didn't cause you any harm. Go for it. Go for it. Pastor David. Oh, there you are, buddy. So again, giving your brain that input, right? So part of the thing is, if you're having a phantom pain episode in crisis, it's your brain potentially searching for stimulation, searching for input. So if you give it input, whether it's by tapping the end of the residual limb, dragging it, maybe even doing a little bit on a rough surface where, again, not chafing up your skin or anything, but just giving that input, it might be enough to distract your brain and have it focus on something else. Drinking electrolytes. Absolutely. Absolutely. So stress, dehydration is another big one right there. Dehydration. Okay. And now we're hearing more about the importance of hydrating, but we also have to remember to replenish electrolytes, right? Especially if you live in a place like Florida where you are sweating buckets and you are sweating out all of your electrolytes, and water is not enough sometimes, right? Kim says, I do chiropractic care over the years and it helps. Okay. Jerry says there's still hope for me. So going back to Pop, he says he desensitizes the limb at about 3 a.m. by running the remaining foot across the carpet to mitigate the bolts of lightning that shock me awake. Bronze Eagle says that weed makes it work for me. Yeah. I don't know why that could be. I'm not going to say I'm an expert on weed. I'm totally not an expert on weed or marijuana. But basically, you're taking in a drug that is messing with your brain. It's altering what's the word I'm looking for? Altering your brain status. So it's messing with your brain in a certain way. Okay. Do I know the intricacies of it? No, I don't. But I do know that it is going to change your perception, right? Making you high changes your perception. So could it affect your phantom limb pain in a positive way or a negative way? Yeah. Okay. Pastor David says, oh no, Kosi, I wouldn't let you near a fast car. See, you don't know. Before I had 4 kids, I was married. I had a wild past, man. I liked racing cars. I'm kidding. I'm a good driver. Yeah, I heard about that. Cass Isidro resigning from the Amputee Coalition. Let's see. Bronze Eagle says I was in a coma, was unconscious, and when I had the compartment syndrome, I went to sleep and woke up 2 minutes later without legs. Yeah. Mary, oh, glad to have you here, darling. I see Pedro Spinner says amputee. Yeah, October 18th, Tampa Hangar Clinic field day. All are welcome. Yes, that is an excellent event going on. I don't know if I'm going to be able to make it. If I can, I will, but it sounds like a lot of fun. It sounds like a lot of fun. Let's see. Harsh says 100% correct about the turmeric. It's natural anti-inflammatory. Golden milk. Yeah. Harsh, do you have like a good recipe for that, by the way? I still haven't found one that tastes good for turmeric milk. Let's see. Ham Sandwich says Miatas are at top of the chart for autocross racing. Need to take my car down there and drag her and her Miata out to a local SCCA event. I don't have a Miata anymore. I'm a mama 4, so I have the Mommobile. When I was working home health, my husband found me a beautiful used Miata. I like my generation. My generation was the second generation Miata that came out, not the bug eyes, but the one that came after that. That's my personal flavor of Miata. And, my husband found a used one in very good shape for a very reasonable price. So when I worked home health, it was great because it was just enough to put all my stuff in the car and I could get everywhere. But yeah. I would love to have a Miata again. I told my husband when the kids are out flown and grown, then I want either a Miata or a Karmann Ghia or an MG. MG would be kind of cool. Okay, we're getting on car talk here. That's about it. All right, guys, let me just see. Oh, finally it started. Oh, nuts. I just realized I missed all the stuff from the Instagram people. I am so sorry, guys. Oh, that makes me so mad because usually I don't get too many comments on Instagram and I forgot to check in. All right. Teresa says, amen to that, Cozy. I just saw my rehab doctor today to get a new script for a new leg. Asked him about my back pain and he explained it because my current leg doesn't fit well and he confirmed what I thought. So see, that's a doctor that is our PM&R doctor. Rick says, traveling in long travels in planes is very hard to me. 16-hour trip to South Africa almost kills me. Phantom pain, cramps, you name it. Yeah. No. For sure. I can totally see how a transcontinental or transatlantic flight would definitely trigger someone's phantom limb pain. That's Rick is asking, is there such a thing as wearing your socket for too many hours? I worry about that all the time. No. And I don't know if Rick, it was you. There was somebody else, I think online. Oh, Harsh, thank you. I'm going to screenshot that. There was somebody else online who was saying something about like their prosthetist said that they were wearing their leg too much or too many hours of the day. I don't know, something like that. I'm like, what? Guys, to me, the most successful stories are when people tell me that the minute they wake up, their leg is sitting right next to their bed. They put their leg on and they take their leg off at the end of the day when it's time to go to bed. To me, that's a success story. And some people have 12, 14 longer hour days. Okay. Now, is it something you do on the first day? No. You have to work your way up to that and you have to have the right training, making sure that your socket is fitting pristinely, making sure that your skin is tolerating everything that you're doing. And you have to work your way up there. But no, I can't say that there's ever such a thing as wearing your socket for too many hours of the day if everything is done properly. If anything, that's what we want. That's what we want, right? Okay, Harsh, I'm going to screenshot your recipe of golden milk. There we go. I'm going to go make that tonight because I've had it once where it tasted really good and I didn't make it myself. So I'm going to try that one. So Harsh is saying, yeah, he's wearing his for 16 hours a day. So no, again, everything has to be fitting well. You can't have any pain in your socket. You need to be nice and strong to make sure you're not causing any injury to yourself, et cetera, et cetera, et cetera, et cetera. But no, by all means, if your leg is doing well and what it's supposed to be doing, yeah, you're going to be able to wear it from morning until night, just not to bed. I know I shouldn't have to say that, but not to bed. You don't wear your leg to bed. Okay, guys. So basically, I didn't think that this was going to be a complete phantom limb talk tonight, but I think we had some really great discussions. And I know I saw several of you here who are new to the show, and I do hope you'll return again. Guys, if you want to text me your questions, here we go. This is how you can do it, where you can get direct access, contact with me. If you have not already done so, guys, I am getting ready to bring my show to sponsors for next year. Okay, so it's around this time of year that I start talking to my current sponsors. I start talking to trying to attract new sponsors. Okay. And this year, guys, I am going to be opening up sponsorships to prosthetist clinics. I am going to be creating a special sponsorship partnership for my prosthetist clinic. So if there's any prosthetists out there or any of you who know of your prosthetist that would like to support the show, I will be doing something like that, and I'll be putting out some notices for that. In the meantime, though, one of the things that I do that when I show my sponsors is I show them how much engagement I have. And you all have been absolutely so wonderful about engaging with the show, sharing the show out, and I truly appreciate that. So I am humbly asking that if you have not already done so, please consider signing up for my text messaging service. I don't spam. I don't sell your number. I'm not going to give your number to my sponsors, nothing crazy like that. It's basically a communication tool. I send you the links whenever I go live. You can send me your questions directly. Okay. And then also, when it comes for the fun stuff, like the giveaways from my sponsors, people on my text messaging get first dibs on those free giveaways. Okay. The Hangar event is going to be here in Tampa, Harsh. It's October 18th. I do have some more. I'll bring more detailed information next week. I did promise them that I promised Natalie that I was going to promote that, and I am going to do that because I think it's really cool. It sounds like a lot of fun. Mark says that was me. They said my prosthesis had issues with having my socket on too much, but that was the first year. Well, if you got to get issues with your sockets figured out, then that comes first, and then you can wear the socket for a long period of time. Okay, guys, Lisa. Oh, I'm sorry to hear that, Lisa, but I hope you can join in next week, and hopefully you'll be able to watch the replay as well. It's what God invented the replay, guys. Last request: sign up for my texting service, and then please share this show to your support groups, please. I would greatly, greatly, greatly appreciate it. Follow me on Instagram, YouTube, Facebook, and I think Rumble. I'm on all those places. All right, guys. Next week, we will be covering the questions that we did not cover today because we were having such a fabulous discussion on phantom limb pain. So we will get to those questions and more. All right, guys. As always, thank you for letting me be a part of your lives this evening. I will see you next week.